Hello friends and welcome to my channel. Today we are going to have a case discussion of a very interesting topic. So first let's see if you can actually diagnose the case. A 32-year-old female came to the clinic or the OPD with complaints of fever, fatigue and severe joint pain. She also complains of loss of hair and on sunlight exposure she feels burning sensation all over her face. She also complains of fingers becoming freezed and white to blue in color on placing them in cold water. So can you tell me what could be the diagnosis? Yes, SLE, that is systemic lupus erythematosus, is basically an autoimmune condition in which the immune system of our body starts attacking its own tissues, causing inflammation and tissue damage. Let's come to the pathophysiology. So basically, what happens is there is antigen antibody reaction. Whenever a foreign antigen comes in our body starts creating antibodies against those antigens that are foreign. But sometimes what happens is our body starts attacking our own antigens, our own body's good antigens, thinking they are foreign, because of which there is own antibody antigen complex formation. Now, what happens is if the complement system is good, they start creating macrophages, and these macrophages completely eat up all these self antigen antibody complexes, and thus the autoimmune reaction is cancelled out. But when the complement system is deficient, that is, the complements which help in making macrophages are deficient, then the macrophages won't be able to eat up these self antigen and antibody complexes, because of which there is autoimmune reaction in the body, and that flares up to SLE or other autoimmune diseases. So basically there's a genetic predisposition for this kind of disease, which is mainly because of two types of alleles or genes, you can say, which is HLA-DR2 and HLA-DR3. So what happens is when an individual has a genetic predisposition, whenever they get into sun exposure, that is UV light exposure, there is cell damage enhancement in that person, because of which the DNA gets exposed and the immune system starts creating antigen antibodies against the DNA exposed and the histone proteins, because of which there is complementation activation, and also there is further damage resulting in SLE. Now, what are the clinical features of SLE? Skin is 85% involved in SLE. First, we can see malar rash, which is also called butterfly rash. Then we have the Raynaud's phenomena, that is nothing but the getting pale or bluish kind of fingertips on placing fingers or hands in water. There is photosensitivity, and usually we see the malar rash when the patient is actually exposed to sun. There is also discoid rash. Discoid rash is basically a rash which leaves a scar. Malar rash does not leave a scar and is mostly seen when the patient is exposed to sun. But discoid rash is different from malar rash, but it is also a cutaneous manifestation which actually leaves a scar. Coming to other manifestations, we have painless oral ulcers, non-scarring alopecia, periungual telangiectasia. There is no form of deformity, but we can also see the involvement of joints of the fingers and toes like MCPs, DIPs, etc. Coming to other manifestations, we have hematological manifestations, that is, we can see cytopenia, that is all types of 3 cells, that is RBCs, WBCs and platelets gets reduced. Coming to other manifestations like xerocytitis, that is nothing but inflammation of the linings of the organs like pleuritis, pericarditis. The pleura or the pericardium gets inflamed. There is involvement of heart, kidney, lungs, vessels and brain also. Coming to heart, we can see pericarditis, myocarditis, and endocarditis. Now, the kind of endocarditis in SLE does not involve any pathogens, so it is not infectious. Thus, it is called Liebman-Sack endocarditis. Liebman-Sack endocarditis. Next, we have the kidney involvement, which results in lupus nephritis, which is the most dangerous form of kidney involvement or the dangerous stage of SLE. And famous celebrity who had severe form of SLE in which she had undergone renal transplant was Selena Gomez. Next, coming to lungs involvement, there can be interstitial lung disease and pulmonary hypertension. We can also see vascular involvement like in vasculitis, thromboembolism, and Apla syndrome, which is associated with recurrent pregnancy losses and DVT. Coming to neurological, we have presence of seizures and also psychosis in such patients. The eye or the ocular manifestations include keratoconjunctivitis sicca and lupus cerebritis. When we look up the diagnosis or the lab values, then we can see three types of main titers. First thing is ANA positive, that is 90% sensitive, greater than 1:80 titer. Next, we have the anti-Smith antibodies, which is 90% specific. And then we have the most important, the second most common specific and most common sensitive, in which most of the SLEs are determined, is anti-dsDNA antibody. We also find low levels of C3 and C4, that is nothing but complement levels deficiencies. We can also see increased level of ESR and CRP in these patients. When we look up the blood profile, we can see cytopenia, that is all three types of blood cells are decreased, that is RBC, WBC, and platelets. Coming to classification, we have the EULAR ACR criteria, which is divided into clinical and immunological domain. In early stages of SLE, there will be only infection and there will be no organ involvement. But in the active years, it can actually predispose to renal failure also. But if the patient is greater than 45 years, there are increased chances of atherosclerosis and cardiovascular involvement, resulting in death due to CVD. Next, we have the neonatal lupus. In neonatal lupus, the antibodies involved are anti-Rho or SSA antibody and anti-La or SSB antibody. We can also see IgG antibody involvement. Coming to treatment, one needs to avoid UV light exposure and stop smoking, that is smoking cessation should be done. Next, he or she can actually do aerobic exercises are recommended. If the stage is mild, we can go for these three. How would we determine if the stage of SLE is mild, moderate, or severe? Mild cases does not have organ involvement and there is only constitutional symptoms like fever, fatigue, malaise, and there is a mild level of cytopenia. But in moderate cases, there is involvement of vessels and pleura as well as pericardium, like how we can say vasculitis, serositis, and they can also be rheumatoid arthritis like symptoms or arthritis. We can also see cytopenia. But in this moderate stage, the cytopenia is enhanced and more than the milder stage. Coming to severe cases of SLE, we treated with hydroxychloroquine, that is 300 to 400 mg per oral daily, plus oral glucocorticoids. High dose IV corticosteroids are given along with maintenance dose of oral steroids like hydroxychloroquine plus oral steroids like prednisone. If there is a sudden flare-up, then that can be reduced by giving methylprednisolone 250 to 1000 mg daily for 3 days. That's it for today's video. For more such informative content, do subscribe to my channel and please hit the like button.